A new report from the Wisconsin Office of Rural Health says that 41% of EMS agencies statewide reported service gaps in the past 12 months.
One EMS agency described it as being in crisis mode, trying to protect the people of their town. Our Andrew Banstra has the story. Andrew?
With inadequate EMS staffing and resources statewide, people in their most vulnerable moments are being given care that they don't deserve. According to the Wisconsin Office of Rural Health, EMS providers and their response times make a significant impact on those life or death outcomes.
Can you imagine calling 911 because your significant other just became unresponsive and it takes an hour to get somebody to your house to do that? When you think that you're paying taxes for providing an ambulance down the street from you from the fire station?
That's the reality for many Wisconsinites, according to a new Wisconsin Office of Rural Health report. They say between 40 and 50% of EMS agencies statewide can't staff ambulances 24/7, 365 like they're required to.
Just within the last week, I've seen data where ambulances were brought from as far away as 30 miles away to handle a 911 call, which took over an hour to get an ambulance on scene at. So, I mean, this is happening today in 2023 in Wisconsin.
When Wisconsin's EMS system was created in 1968, it was largely volunteer run. Today, volunteers are harder to come by, and staffing an agency year-round is simply a bill these municipalities can't pay.
If you go from a service that's been all volunteer and then you need to staff it with all full-time staff, that's a $600,000 difference. These people aren't being served well. We're not serving the most vulnerable people in our community at the point when they're the most vulnerable. And it's going to take money to increase that.
James said, too, the Wisconsin State Office has 3 regional coordinators to supervise 800 agencies and 18,000 providers.
This didn't happen today. It reached a crisis point now. And this is really the opportunity of where we have to make a decision on how we're going to keep delivering these services at a local level.
30% of EMS agencies said they don't have the funds for next year. But what's the path forward?
Many communities don't have the resources to fund it at the level that they need to fund it at. And it's a municipal service. So the expectation that somebody is going to do this for free or at a very low cost and personally subsidize the cost to the local taxpayer, that's just a poor expectation. We don't expect that of our public works employees. We don't expect that of our law enforcement. But that's been the ongoing expectation in fire and EMS.
James says the best actions to fix this issue are to create recurring funding from the state to solve the problem that they say has reached its tipping point.